The recovery package is part of the Living With and Beyond Cancer programme, part of the National Cancer Survivorship Initiative that was rolled out from NHS England and supported by Macmillan to help people who've had a diagnosis of cancer, help them through their recovery, future treatments, and really to try and get them back into some sort of normal life. So the recovery package did concentrate on what we called the holistic needs assessment and a care plan to address these needs, a treatment summary for patients, carers, GPs, primary care to know exactly what's happening. What they asked for was a GP review within 6 months. So this initially was for people potentially for breast, colorectal and urology cancers, living with and beyond. And then a health and wellbeing event for people to try and again help them with their recovery. So I was very keen to look at this from the lung cancer perspective because there wasn't anything out there, and we know people are living longer and surviving, but often with many complex needs as well. So I really wanted to address what the people who had survived, the ones who I looked after, had experienced and wanted from the recovery package. Very interestingly, although the initial survey didn't demonstrate that the 4 areas of the recovery package had really been addressed, looking at holistic needs assessments, there was a mixed response. Many people couldn't remember being offered this, and so I wondered, was that really a priority? I think what it did show is that although a formal holistic needs assessment may have been forgotten, they felt that their needs were addressed if they had one-to-one support, certainly from the CNS, from the oncologist, from the surgeon, from the respiratory physician, that when they had an issue they could contact someone direct and have all their concerns addressed. I think the challenges are vast, to be fair. I think in the present climate, many of our patient groups sadly are very ill and die within 12 months of diagnosis. And I think for the people who are living with and beyond, if they continue to have treatment, then they get the support. For many who've completed treatment, there's not that much out there, and I think we really need to concentrate on a structured rehabilitation programme, an exercise and support programme that they're very actively involved with. So as part of the National Lung Cancer Forum for Nurses, I actually got an award to take this further. So what I want to see is, along with the rehabilitation programme, so that's the physical exercise supported by physio, and on an established rehabilitation programme, we incorporate more support. Be that activities, we look at Tai Chi, yoga classes, a choir. It's getting everybody more active and supported, really giving them the confidence back that they may have lost because of the diagnosis and the treatment.